My name is Sandhya. We have twins in the last April. After that, we have immediate conception, and the baby was 24 weeks old. We have excessive bleeding in the last evening around 6 o'clock, almost more than 1 hour. We've been to nearby hospital, but nobody helped us with the treatment. I know it was an emergency, and we fighting to survive the life. And luckily, we came to Prathima.
I'm Dr. Madan Reddy, consultant emergency physician at Prathima Hospital, Kukatpalli. Yesterday, we have received one patient by name Sandhya, 31 years female, obstetric emergency. She's 24 weeks of amenorrhea, presented to emergency with severe bleeding per PV. On arrival, she was a little bit drowsy. Her BP was like 60-40. Resuscitated with starting with crystalloids, and we have started vasopressor infusion followed by blood transfusion. We have informed our gynecology team.
We got a call from outside hospital that they have a second gravida with previous 6 months of gestation with heavy bleeding, and she is in shock. And they are referring the case here because we are having ICU, critical care team and emergency team, ER team. On receiving the case to resuscitation, we have seen she underwent a twin delivery 9 months ago. She underwent IVF and twin delivery with cesarean 9 months ago, and she conceived immediately within 3 months. And she is also known diabetic since 8 years. And on examination, she is almost in shock with severe pallor. And we have suspected abruption or rupture, and immediately I have informed our other gynecologist team.
As soon as I came to know about the patient, I saw the patient and called upon the patient attenders and explained regarding the condition of the patient and the complications and the outcome of the patient were explained to the patient attenders. We explained regarding the need of emergency surgery and a need of multiple blood transfusions and immediate post-operative ICU care. We explained regarding two conditions. One is abruptio placenta and ruptured uterus. If it could be abruptio placenta, we explained regarding the need of emergency surgery. We explained regarding two conditions. One is abruptio placenta, where we could retain the uterus. The other condition is ruptured uterus, where there is need of removal of the uterus. So consent was taken for removal of uterus, and after taking high risk consent, patient was shifted to OT immediately and surgery was started.
నా పేరు శేఖర్. మా వైఫ్ ప్రెగ్నెంట్. 6 months ప్రెగ్నెన్సీలో సడన్లీ ఇంట్లో ఉండగా బ్లీడ్ అయ్యింది. సో మేము ఇమీడియట్లీ ఒక హాస్పిటల్కి వెళ్ళాము. హాస్పిటల్లో గైనిక్ సరిగా లేదని చెప్పేసి వాళ్ళు ప్రతిమ హాస్పిటల్కి రెఫర్ చేశారు. ప్రతిమ హాస్పిటల్లో వితిన్ హాఫ్ అన్ అవర్ 40 minutesలో సర్జరీ ఓటీ టీమ్ ఆపరేషన్ థియేటర్కి తీసుకెళ్ళి వితిన్ 1 hourలో ఆపరేషన్ సక్సెస్ చేసేసారు.
Hello, I'm Dr. Madhavi, practicing consultant in the Prathima Hospital. My other colleagues and ER, Dr. Madan Reddy has explained about the case. I just want to tell about the brief. This is the patient Sandhya. She has delivered 9 months back. She has conceived with IVF, twin pregnancy. She has delivered 9 months back. Within 3 months, she conceived back again. Now she was, when there was a rupture, she was 6 months amenorrhea. Phone call has come from the other hospital to our gynec department that one patient is in shock and it's an obstetric emergency. As you people have the ER team and ICU and all, we want to shift out here. So I said, okay. The other gynecologist, Vinayana, said okay, and they have shifted. And in the ER team, they have managed and they stabilized. When the patient came over here, our BP was very low, 60. It was 60 systolic, and they have stabilized her with IV fluids, steroids and all that, non-adrenaline, and they have infused one whole blood just then immediately they shifted to the OT as everybody is cautioned, and the two anesthetists were there. We all 3-4 gynecologists were there. When we opened, like we were in dilemma what it could be. Either it could be an abruptio or it could be a rupture. So when we have opened, we could see the pale white uterus and little bit of blood seepage into the serosal layer of the uterus, and immediately we have given incision and taken the baby out. But simultaneously we could see even the rent in the lower segment. There's a lot of retroplacental clots were there. Sutured the uterus and even sutured the rent. We have secured the hemostasis by giving the prostaglandin injections, and so everything was maintained, and we have checked and kept the open abdomen for 15 to 20 minutes. After we felt that uterus is totally contracted and retracted, then we closed the uterus. And when she was shifted, her HB was 6 grams. and almost we have given 3 full whole bloods, 2 FFPs and 2 PRPs, and today is the next day afternoon her HB is 5. Almost we have replaced everything.
I'm thankful to Madhavi Ma'am and all the 4 gynaecs who helped us to retain our life. When we entered, we almost have 4 to 5 grams of bleeding or more than that, and I could hear my heartbeat clearly. And I know my pulse rate was down, so the doctors helped us. A lot of confidence first. Then they started the treatment. I think this is the best hospital we ever been.
Presently my wife బాగున్నారు. She is now safe and stable, her health. Thanks to Prathima Hospital and thanks to Madhavi Madam team.
And now, and you have seen the patient. Patient is so happy. We are very much delighted. With all of our team, we could save her. And I just want to share this obstetric emergency with you all. Thank you.